Hi, I'm Dean Turner, and I'm going to do a AED inspection. So we'll start off with the cabinet. To inspect the cabinet, look at the general condition of the cabinet, make sure that it's not dirty, the glass is okay, and when you open up the door, the alarm goes off. If it doesn't go off, then there's usually a switch inside and a little battery, 9-volt battery that goes inside. That's one. Next thing you want to do is see that it has an AED sign, one that's going to be visible for all employees, sometimes one that is triangular so they can see from all directions where that AED is housed. The AED itself. This particular AED is called the Defibtech. The Defibtech, notice the shape, around the side it has a black bumper which allows for a drop test. There's two buttons. The green button is an on-off button and the orange button is the shock button. In this left-hand side here, there's a little plastic spot which has a green light that's flashing. The green light flashing indicates that the AED battery and pads are okay. If the battery is having a problem, then it's going to flash red. When I turn the AED around, notice this pad. So I can pull out the pads and inspect them, making sure that you see this white square, that the expiry date is within its range, so it's not expired. Pads are generally good for 2 years. Here, this silver bar is where the serial number for this AED is located. So when you're doing the inspection, we want to make sure that we note the serial number, make sure that the location is identified with this particular AED. So I can put the pads in, and I like to place the pads so that the serial number is visible. So when I take the AED out of the case, look at the light, look at the expiry date, look at the serial number, and then what I'll do is I'll just turn the AED on. When I turn it on, and then once I turn it off, if there's any problems, it will say at that time what the problem is. Watch.
Call for help. Remove pads from package in back of unit. Apply pads to patient's bare chest as shown.
Here are the pads.
Apply pads to...
When I turn it off, it didn't say anything. If I was to take the 9-volt battery out, for instance, it will say replace 9-volt battery. Or if the battery is low, it will say replace a battery. So that's how the AED is inspected. Look at the spare set of pads, and again, serial number, make sure that it's also within the date range. Next thing we would inspect is called the rescue kit. Inside the rescue kit are a razor. So this razor is, if a person has a hairy chest, you want to shave them just where they're hairy, where the pads are going to go. You have a set of scissors, or a pair of scissors, and these scissors are for removing of clothing or a bra if necessary. Here's a CPR mask with a one-way valve, so when you have to do breathing on it for this person, then you're going to be protecting yourself as well as the person. We have 2 sets of non-latex gloves. And with cardiac arrest, and someone with some cardiac arrest, a lot of times there may be sweating, so you want to dry off where you're going to be placing the pads. Some AEDs will also have a carrying case with them. And if so, just take a look at the carrying case, and you may see that the pads, the spare pads, might be in this zippered area here. The AED can be housed inside the case with all of these accessories. Thank you.